Hello, my name is Tony. I'll be your nurse today.
Hi, how are you?
How are you doing today?
I'm doing well.
Okay, so we're just going to start with your name and date of birth.
Stephanie Lassiter. My date of birth is 9/28/63.
Okay, now can we discuss your health history and any issues, health issues, surgeries?
Sure. Actually, right now I don't have any health issues. I'm doing fine, thank God. But I have had over the years a couple of feet surgeries on each foot.
Okay.
I've had a surgery on both breasts. It was just like a pellet. They did a biopsy and took the piece out, whatever, from a knot.
Okay.
And basically, that's it.
Okay. And what years were those procedures?
The procedures for the breast was in the 80s, twice in the 80s.
Okay.
And the foot was like maybe 96 and 2003, something like that.
Yes, ma'am. And are you taking any medications?
Yes, I take medication. I have scleroderma arthritis.
Okay.
I take a prednisone and a Procardia.
Okay. Any over-the-counter or herbs?
Well, I just became an herbalist, so I don't have my apothecary cabinet together yet, but I do a lot of natural stuff.
Okay. But you aren't taking anything in particular right at this moment?
No, ma'am.
Yes, ma'am. Any allergies?
No, ma'am.
Okay. And have you had your flu shot?
I don't do the flu shot. I figure if it ain't broke, don't fix it.
Yes, ma'am. Okay. And because of your age, 50 plus, we do recommend the pneumococcal vaccine. Have you had that?
No.
Okay. So at the end, with your discharge paperwork, I'll have some information on the flu shot and the pneumococcal vaccine. So just so you can go over to educate yourself and make a decision from there. Does that sound like a plan?
That's fair.
Okay. Okay. So how's your appetite been in recent days?
Well, appetite is pretty well. Back in the end of May, I stopped eating meat.
Okay.
So I had to really adjust my diet, and I've been doing pretty well. I mean, I usually eat fruit before I put anything else on my stomach in the morning, which helps curb my appetite. And I'm at a perfect weight for me. And I talked to my primary care doctor about it, and she said, she had been vegan one time, and as long as I get the proper proteins and stuff like that. So, but my appetite is good. I mean, when I'm hungry, I eat. When I get full, I stop eating.
Okay, great. So you covered the protein and you have a healthy appetite. So at this time, I'm going to do your abdominal inspection. So can you tell me when your last bowel movement was?
This morning,
Okay, and are you regular? Do you typically have a bowel movement every day?
every day, twice a day.
And can you describe your food to me?
Very healthy, like turds.
Okay, and the color is normal? Okay, and when was your last menstrual cycle?
Oh, well, I am 60. My last menstrual cycle was at 47, so that's 13 years ago.
Okay, so and are you getting regular pap smears?
Yes.
When was your last pap smear?
July,
Okay, and are you aware of how often you're supposed to get them?
every year.
Okay, do you get them every year?
I do.
Yes, ma'am. Okay, so at this time, I'm going to ask you to lift your shirt up so that I can visually inspect your abdomen, then I want to listen here. Okay. Alrighty. Okay, any pain in your abdomen? Any pain?
No.
Any trouble starting to stream when you go? When you urinate?
No. Oh, excuse me. Go.
Now I'm going to do some percussion and palpation to your abdomen. You just let me know if you feel any pain, okay? Now I'm going to apply some pressure. Once again, a little pressure here. Alright, and that concludes that part of our assessment. Okay. Move on to my next question. Do you use any assistive devices, any canes, walkers, boots, anything? Alright, so I'm gonna put up some gloves now so we can start the exam process. Is that okay with you?
That's fine.
Okay. Okay, so I'm going to start with getting your blood pressure. We're going to use my made-up blood pressure cuff right here.
That's smart.
Alrighty. And we're going to be doing the manual here. Alright. Just relax for me. Alrighty. Your blood pressure is X over X. Can I get you to state your height and weight for me?
My weight is 118 and my height is 5'3".
Yes, ma'am. Hey, let me take a look at your hands. Okay.
The camera need to see you do that because they can't see you.
Alrighty. And let's see your nails. Okay. What about pain? Do you have any pain anywhere on your body?
I usually have pain in my hands, especially on the tips, because of my scleroderma arthritis. My bloodstream don't open and close like it should, my blood vessels. So I have a lot of poor circulation. So, yeah.
And when you do have that pain, what would you rate it from a 1 to a 10?
A 7.
A 7? Yes, ma'am. And does it radiate anywhere?
Yes. Yes. Sometimes I get, I can't swallow very well.
Okay.
Or, like when I breathe in, I gotta do like a hard breathe in.
Okay. And numbness and tingling. Do you experience any of that anywhere?
Numbness, yes.
Just in your hands?
Just in my hand.
Okay. And let me see your hands one more time. Just want to check for capillary refill. I apologize.
Please that one.
Okay, that's the one that gives you the most issues? Okay, yes,
That one.
ma'am.
And this one, it's not too sick fingers.
Okay, yes, ma'am. Okay. So, we're just going to pretend the scalp is out and that the patient has on a gown for the rest of this inspection. So, now I am going to check your scalp, okay?
Okay.
Just checking your scalp. Okay. And just looking, kind of look over all your skin. Can I get you to stand up for me? So I can look at your back side as well. Turn around for me. Alrighty. Okay. Alright, you can have a seat again. Now, can I get you to smile and frown a few times repetitively? Smile. Now frown. Smile. Frown. Alright, thank you. Just checking for symmetry of your face. Now I'm going to check your okay, and now can I get you to smile for me? Alrighty. Now do your jaw like this. Just open your mouth and yep, there we go. Alrighty. Now I'm going to check here. Alrighty. Just checking for lumps. And so the next portion of this exam, I'm going to be testing your eyes. So let's start with vision issues. Do you have any vision issues or disorders?
I wouldn't say disorders, but I wear glasses, reading glasses, and I have a couple of prescription pens.
Okay, so corrective and reading glasses.
Yes.
Okay, and no false eyes.
No.
Okay. Yes.
What is false eyes? Like contacts?
No, like a fake.
Oh, no.
And
Glass eyes.
yes. So I just want you to follow my pen with just your eyes. Okay, great. Okay, now once more. Okay, great. I'm just going to take a look at your. I'm just going to take a look at your eyes now. Just going to, you know, examine your lids. Okay. Now you're going to see a bright light. Okay.
I really got one of them things if you want it.
Okay, so on to our ear exam. Do you have any hearing concerns or do you wear hearing aids?
I wear hearing aids.
Okay. Do you have them with you right now?
Yes.
Okay. You don't wear them all the time?
Not all the time.
Okay. So, for the most part, you can hear me clearly now. Do I need to speak up?
Yes.
Okay. Yes, ma'am. Okay. So now I am going to just take a look at your ears. I'm going to look at the outside first, then I'll look in. Okay. Alrighty. Go over to the other side. I'm just looking in at your eardrum. Okay. And now we're going to do a whisper voice test. So that goes along with the hearing situation we have going on. So I want you to just raise your hand once you can hear what I'm saying. Okay, I'm going to speak at different tones until we get the perfect picture. Okay? Okay.
I didn't hear what you said, but I knew you were saying something.
Okay, let's try one more time because I need you to tell me what I said.
Beak activator.
Okay. What did I say?
Toast and ham.
Yes, ma'am. Okay, so now we're going to do the nose and the mouth. So I'm just going to take a look at your nose. I want to look inside here. And can I get you to wrinkle your forehead? Okay, just looking for symmetry here. Okay. And can you just open your mouth just slightly for me? Okay. Now open your mouth all together so I can see your teeth. Okay. Alrighty. And stick your tongue out. Perfect. And can you lift it up so that I can see the roof of your mouth? Okay. There we go. Now I am going to change my gloves because I do need to stick my finger in your mouth just so I can look at your bugles. All right. Say ah.
Ah. Ah.
All righty. Great. Thank you. And just one more time, say ah for me.
Ah.
Okay, perfect. Thank you. Okay, so I'm going to do an inspection of your neck. So I'm going to pull your turtleneck down. Okay. I mean your gown. Okay, now I am going to check your pulse.
He suggested that you take out a loan, consolidate all this debt, which was on, I assume, all credit cards with very high interest.
Now I need you to move your neck forward for me. Move it back. Now I need you to turn your head to the left, then the right. Okay. And do a shoulder shrug for me. Okay. Thank you. I want to just palpate your thyroid gland here.
each month, starting in March or April.
Okay, so now we're gonna work on our upper extremities, which is your arms. So I'm just gonna take another inspection, just looking at them. We're gonna test your strength. So can I get you to hold your arms out like this for me? Okay, now I wanna push down and I want you to try your hardest not to allow me to do so, okay? Keep your arms, okay, great. Now hold your arms like this. Okay, now I'm gonna push up against you and you push back towards me so that I don't push your arms inward, okay? 1, 2, 3. Yes, yes, nice and strong. Okay, and can I get you to just move your arms just around, just freely? Yes. Okay. Now we're gonna do the finger to nose test. So you're just gonna. Okay. And just checking to make sure your shoulders are even here. Okay. And can you shrug one more time for me? All right, now release. Thank you. Okay, so the next part of our test is I'm testing your chest. So just looking here to see an inspection of the skin. I need you to take some deep breaths for me. Thank you. Just checking for symmetry once again. Okay, beautiful. Okay, now I am going to listen to your breath sounds from the back. So can you just sit up for me? Can you actually turn in the chair this way for me? Thank you. So I have better access. Okay. All right, take a deep breath for me. Okay. That's more. Okay. I apologize. Okay, now I'm going to listen to your breath sounds from the side. So if you can just lift your arm up for me just 1 second. Okay. Now I am going to run my hands down your back, and I want you to say 99 every time I adjust them, okay?
Every time what?
I adjust my hands, I want you to say 99, okay?
Okay.
So I'm going to start here. Okay, go ahead. 99.
99. 99. 99.
Okay. I want to do the same thing in the front. Some more.
99. Ouch, 99. 99.
Okay, more breath sounds you want to listen to. So you're going to take a couple more deep breaths, then I'm going to listen to your heart. Okay? Deep breath. Alright, and now your heart. It's going to come up under here. Just breathe normal. Okay. And when was your last self-breast exam?
July.
Okay. And a mammogram?
July.
Okay. So you did them both about the same time?
Yes.
How often do you do your self-breast exams?
I do it about 2 weeks before I do my mammogram and a couple of weeks after I do my mammogram.
Yes, ma'am.
Every year.
Yes, ma'am. Okay, so now for the last part of our exam, I am going to start with just examining your legs. I'm checking for edema, which is puffiness of the tissue, basically. Once I release, now I'm going to check your pulses. We'll start with the foot here. Alrighty. I'm going to check the back here.
From June 2020 until January 2022, because they hadn't completed a job for you, despite the fact that you purchased the car. I would call that same mechanic back. I wouldn't call that same
to just take a look at your toes. Hopefully you're not too ticklish. I need to separate them.
Child, mom was ticklish. You couldn't touch her feet.
Okay, now I'm just testing your range of motions for your lower extremities. So, for starters, I want you to, we're gonna start with the hips. So just turn side to side for me. Just turn your, just from the hips. Alrighty. Now, bend your knees up, high knees for me on both sides. One more time, thank you. Now your ankles, can you just lift your foot out, rotate it, thank you. Same on the other side. Alright, now can you do your foot like so? Yep, thank you. Same on the other side. Okay, now for our next exercise, I want you to run your heel down your shin. Okay, same on the other side. Alrighty. Now we're gonna skip one section really quickly, and I just want you to walk forward, and then I want you to turn around and walk back towards your seat. Okay. Just checking your gait, see how steady you are. Alright, you can have a seat now. Thank you. And this is just the last part. We skipped this. This is the Babinski reflex. I'm just going to run my tool across your foot. I'm going to lift this foot up. Ooh. Just checking for your reflexes here. Alright. So at this time, that concludes our exam. Thank you so much for participating.
Yeah, sure.